WMEL.
That's the sound of the 1951 Ford Victoria Hot Rod, fully restored and donated from the private collection of A.J. Hires. It's the 2017 Win the Classic Ford Car Raffle to support Helping Seniors of Brevard. You have to see this car. I'm Kerry Fink, and I'm inviting you to visit helpingseniors.brevard.org for full information on this exciting car raffle. That's helpingseniors.brevard.org. Stay tuned for more info on the Talk to Me radio network. We're glad that WMEL cares about the space and Treasure Coast.
The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
This is Joe Steckler, folks, your host for Helping Seniors, a radio arm of Helping Seniors of Brevard Incorporated. Our purpose is to inform, to educate, and to connect seniors and those that assist seniors with the services that exist in the area. And my panelist today, when I introduce him, is you'll see this type of services he does and how more of us need to connect with organizations like CarePatrol. And Rob will explain what CarePatrol is. But before I get to that, I want to make sure that you understand that, we're near the end of the year. It's the Christmas season's coming around. I did an article in Hometown News last week about just being a good person and connecting with others that don't have anybody to help them or care for them or be a friend to them or assist them when help is needed. And more of us need to think about this, and especially the families. And I know several people called us and were one person talked for 4.5 minutes about the problems that he had since his wife had passed away. And these are sad things. But if we do a better job of, especially at Helping Seniors and other organizations that are our sponsors, if we do a better job, we can help more people. And that's the purpose of this show, is to make you aware of how you can get the kind of help that you need so that you don't get the incorrect information or get information that causes you to have to keep searching, and that's just a waste of time, and it often gets you in a poor position to take care of the person that you want to get help for. The other thing that we do is advocate. We advocate for seniors, and there's so much going on in the newspapers today about aging matters and Meals on Wheels and how the government has short-circuited them on taking county money away from for nutrition, and that's not helping us get the right kind of information out. And we hope to dispel some of those myths on our radio show. These are all good programs. They're all needed, and that's the value of having good information. But, our sponsors help us pay for it. And Rob Graham from CarePatrol is one of our sponsors. He's my panelist today. But we have the Eye Institute, Dr. Lee Sheldon, Bill Johnson, elder law attorney, is on Beachside Assisted Living, Riverview Senior Resort. And we were going to have a person from Riverview here today, but they had a situation where they couldn't make it. They had to call in. So Rob and I will both try to fill in for Jackie Eastline. So if you hear a male voice purporting to be a female voice, you'll know why we're trying to do this. But it all has to be in good fun. So having said all that, Rob, welcome to the show today.
Oh, hi, Joe. It's good to see you.
Good. It's good to see you again here, too. But Rob Graham is the owner of CarePatrol, and I think we're going to go into probably some extensive talk about CarePatrol today because some of the stuff is repetitive, but if you don't understand it, being repetitive makes it worthwhile. I was asked to come back and speak to a church group because they wanted more information about the things that I talked about the first time I went there. I couldn't cover it all. Same thing with radio, Rob. What is CarePatrol? What do you do?
Well, CarePatrol is a company that works with families to try to locate independent living, assisted living, memory care, in-home care for their loved ones. And it's a free resource to the community. So we work with the families who are in need of having to relocate a loved one, perhaps out of the home if he or she is no longer safe at home alone, or if there's not a willing, capable caregiver at the home. So we will work with the families, and we're connected with a number of different referral sources throughout the county to try to do appropriate safe discharge planning in conjunction with our referral sources so that Mr. and Mrs. John Q. Public can be safe outside of the home in an appropriate setting.
Well, that's why I made that comment I did, that we need to keep talking about some of these services, because they're all designed to keep patients, clients in an appropriate and safe level of care. But what is safe and appropriate for one might not be the same for the other. And can you explain that to our listening audience?
Sure. Forgive the long-winded answer, but because it's not
No, that's what I want you to do.
Because it's not a quick answer. There are, oh my word, let's just talk about in the case of assisted living and memory care. Depending upon the day of the week that you ask, there are 175-ish plus or minus located throughout the county, excuse me. And the vast majority of those assisted living locations are actually residential in nature. They're single-family homes. They've been adapted and outfitted to satisfy the state of Florida to be operating as assisted living. The remainder of the assisted living locations are what we call the assisted living communities. And you mentioned a couple as far as sponsors.
Right.
Zon Beachside and Riverview Senior Resort.
Right.
And it's important to understand the lay of the land when it comes to what your options are out there. Because if my mom, who lives in the South Shore of Boston, called me up and said, "Geez, Rob, I've got something going on with me. I'm just not feeling right," we would have to dig in and understand what that means. We have to get into some very detailed conversations to understand what my mother's specific care needs are, and to the best of our ability, be predictive in nature to see what they will be down the road,
right,
depending upon what she has. The other aspect that's critical to identify the most appropriate setting for someone, we have to understand their social acumen. Said another way, are they alert and oriented? If so, to what extent are they typically engaging with other people? Are they more reclusive in nature? If they are, why would that be? Could a change of scenery, if they're in a safer location, change that? So we have to deal with a fairly large petri dish of different variables. And while there are many assisted living locations throughout the county that are excellent, not every single location is appropriate for every single person. So the goal is to identify, go through this discovery phase of identifying what the specifics are from a care perspective and a social perspective, and then go through the matching process with the menu of communities, residential ALFs, I call them ALFs, assisted living facilities, match them to the best of our ability.
Yeah. Let's take it one step lower than what we're talking about right now, and let's talk about it. You mentioned assisted living facilities and what they can do. Let's talk about care agencies like Seniors Helping Seniors with Jennifer Helen's group, and they try to go out into the homes and direct their services to the person in the home. And I've talked to Jennifer, but I've talked to other organizations that provide respite care of the type that she does. And I want you to explain what respite care is too. But some of these people, and you mentioned appropriate, and that word's very, very important. Good healthcare agencies, the person that they assign on the first occasion to care for the person might not be that person that's appropriate to be that companion care person for that person. They might have to change them. And this is what the good home health care agencies do. They try their very best to get the person connected with the right level of care on the first shot. It doesn't work. They go back and they check. And if they find out it's not working, they adjust and they make it work. So talk about the when your organization goes out and you go out to find out what really people what they really need, and you get a call. Let's say you might get a call. The person you think a person needs a certain level of care, and you go out. And what kind of checking do you do? Like on the activities, daily living. What do you do to see what you can do to sort of keep that person in the lowest element of care?
Well, first of all, let me be clear. If someone can remain at home and it's a safe environment and there's an appropriate, willing caregiver available, then we're always going to be all about that first and foremost. However, there are times that cannot happen. But when it can happen, then we try to understand. It works very similarly with trying to place someone in appropriate assisted living. You've got to understand what the individual's care needs are. You mentioned activities of daily living. There were 6 of them. Feeding, right, toileting, dressing, grooming are just some. And the level of help or assistance that they need with each of these activities of daily living will help us calibrate what type of care and how much care is needed for that particular individual. Believe it or not, sometimes there are people who live by themselves and they're doing reasonably well physically, but they're just not able to access the outside world on their own because, let's say, they've lost their license, family's not around, they don't have a bunch of friends in the area. So we get calls to try to see if we can locate a home health, which is really, I'm going to be clear about the nomenclature. When I say home health, I'm also meaning private duty for them to send someone to come in, and even if it's just custodial care, spending time with that senior so that they get that level of socialization that's critical. So we go through much the same process. There are well over 100 of these companies in Brevard County. And the vast majority, when I mean the vast majority, all but a handful or so of these companies work of what's called a registry. And a registry works very, very differently than the companies that are really agencies. Agencies employ all of their caregivers. They're licensed, they're bonded, they're insured. So God forbid if someone comes into the house to care for the senior and he or she falls, there's no concern about being covered from an insurance perspective.
Right.
Registry, on the other hand, they don't always have that proper coverage. It's a registry, think of it this way. It's a stable or a list of caregivers that a number of different private duty companies can pull from to try to schedule an individual to go to a senior's home for X number of hours a day to care for that senior. So the risk has been over time that, think about it this way, if someone has dementia, whichever dementia we're talking about, they really are best matched with a company that can provide a good continuity of care, meaning they have 2, maybe 3 rotating certified nursing assistants that can come in and care for that individual. Because seeing 5, 6, 7 different people coming in over the course of a week or 2 can be disruptive to them. It can be confusing. Agencies typically do a better job because they have better control over their scheduling than a company that works through a registry. Because remember, if I'm a certified nursing assistant and I'm on that registry, any one of a number of different companies can call me out of the blue and send me the next day or 2 days from now to work at a different senior's place.
Right, I understand.
So it's critical to understand the difference between the two. Pricing is close between registries and agencies. They're $2 or $3 an hour difference, but that's it. So the goal is much the same. Again, line them up with the most appropriate care, the company that actually can deliver what they promise to deliver. It's 2 different things. There's capabilities and willingness. Everybody has the capability. You just have to make sure that you're aligned with a company that has the willingness to deliver on the promise that they're going to provide good care for that loved one.
Okay. Do you know why I'm so, maybe I could use the word adamant or insistent that we keep hammering at this subject? Because it's for this reason. I go to the yellow pages in the phone book first. If I can find the phone book, I go to the yellow pages of that book, and I start looking in there. How do you really know what, the average person might hear about a nursing home, or they might have heard about assisted living, so they go looking at the phone book and they find an assisted living facility, and they say, well, bring a person in, or come in, we'll see if it's appropriate. So the people, they get sidetracked and many times get placed in a level of care that they don't need to be placed in. Mm-hmm. And the average person knows so little about this subject that's why I keep using the words elements of care. I've been doing this for years that I've been in this care business. I say elements of care because there are very extremely low elements of care, like seniors helping seniors, that can do some basic things mm-hmm. that people need help with, to very hands-on care, skilled nursing care. But a company like yours goes in for absolutely no cost to the family.
Yeah, that's right.
And assesses the situation and says, you don't need to take your mother or your father and put them in an assisted living facility yet. You can put them in this level of care at this cost.
Yep. There are lots of
that to
sure. First of all, there's just a huge amount of misinformation out there when it comes to healthcare, specifically in-home care, assisted living, memory care. Believe it or not, we run into a significant amount of families who are absolutely convinced that their mother needs to be in skilled nursing, in a nursing home. And when we ask the questions, as you said a few minutes ago, when we conduct the assessment, there's really no need for a skilled nursing environment. All they need is socialization, shower assistance, and to be fed nutritious meals. That's not skilled nursing.
But to make sure they meet their meals. This is something over the years I've found that many people, senior citizens, get placed into an assisted living facility or some type of a care situation, and they're fed food that they don't like, mm-hmm. and they may not really, they simply just don't want to eat it, so mm-hmm. they don't do it. Mm-hmm. And this is a big problem. Feeding is one of the biggest problems we come across in the care industry.
It's huge.
Getting people to eat.
Yep. Because and a lot of bad things happen. It can happen to people and do happen to people that suffer from poor nutrition. Let's be frank. There are care levels throughout the country that are more institutionalized in nature. Okay. For example, nursing homes. There are probably anywhere from 120 to 160 beds located in these skilled nursing facilities. A portion of that facility is for short-term rehabilitation services, but the remainder of the facility is for long-term care beds, right. Nursing homes.
Right.
And that's just institutional, period. There's just no debate about it. And in that type of environment, it's virtually impossible for them to provide any type of customization for my mom, as an example, to understand what her specific needs are from a nutrition point of view, from a care point of view. Whereas if you can keep someone at home and you have an in-home, and if you have a private duty in-home caregiver, he or she can ensure that my mother's fed and will actually eat things that are good for her that she'll actually eat and not push the plate away. So that level of customization is critical, especially when you are dealing with people who have higher acuity needs from a care point of view, because it's difficult to execute. Not impossible, but it's difficult to execute that customization level in an institutional setting.
You're hitting all the key things that that families need to think about, and even more so, Rob, at this time of the year. We're just past the Thanksgiving period, and now we're starting to think about the holiday season, the New Year coming on. Families get, at the end of the year, they get sort of depressed about not being able to solve a problem that maybe has been nagging them for 5, 6, 7, or 8 months. So they make a hurried decision, and that's not good.
It isn't necessary either.
It's not necessary, and I can speak to that directly because I personally have knowledge of situations where we have been able to recommend, and doing exactly what you do, but not seeing as many of the situations that you do, on a daily basis. But I've seen it over the years that a person can be appropriately cared for and kept in their home, eating the foods they like, in familiar surroundings. They may just need a start in the morning to get up, get dressed, and get breakfast and do some tidying up around the house. And you don't have to have a full-time caregiver. And that type of care can be sought 7 days a week for roughly $1,000 or $1,200 a month.
Yeah, I mean, there are many, many times where we'll get calls from families and they meaning the individual, does not need a 24/7 caregiver. 24/7 caregiver is expensive. I mean, it's going to be about $9,000 or more per month, depending upon the level of care. Oftentimes, we will talk to the family and say, let's think about what mom needs or what dad needs, and let's see if we can put our heads together and cobble together a schedule for the week that limits the cost without putting the individual at risk. So let's come up with 20 hours a week that a caregiver can come in, do some light housekeeping, make some meals, give showers, and spend some time socializing with the individual. Many times, that does the trick just fine.
To sort of enforce what Rob just said, I'm going to mention this number before we take a quick break. I read a thing on the Elder Law Association Network talk about the holiday season. It said that a 2013 Conversation Project survey found that while 90% of people said it's important to have these type of discussions with their loved ones, fewer than 30% had done so. So with that thought, we got the music signaling our mid-show break, folks. Stay with us. I actually have only looked at 2 questions that Rod sent over to me that we could talk about today. So and there's 8 or 9 more. So we'll have plenty to talk about in the second half. So stay with us.
WMEL.
This is Joe Steckler, folks. We're back live with the second half of Helping Seniors, the radio arm of Helping Seniors Incorporated of Brevard County. Our program is designed to educate, inform, and connect seniors and those that care for seniors with services. We also advocate for seniors. Our whole thing is paid for and most by our sponsors, and some of them include Spotlight Magazine, Hometown News. We have roughly 2 columns a month 2 columns a month in Hometown News, Senior Scene Magazine, with a distribution of 40,000. The Seniors Helping Seniors, Barbara McIntyre, Home Equity Loans, Canadian Meds of Melbourne, Ear Care, Vitas Hospice, Aldea Today, and Ebony News Today. So we're in all the newspapers that reach out to every community, the Black community, the Spanish community. We're also in the Barefoot Bay Tatler, so we reach roughly 25 to 30,000 people or senior citizens down in the Barefoot Bay area. But during Gary Allen, who is running a booth for us today, came in and said that there was a national thing that came out and said that, what was the guy's name?
Jim Neighbors.
Jim Neighbors, who was the Gomer Pyle guy that the sergeant used to pick on all the time. He passed away. And I think he said there's only 2 people left from that Andy Griffin show.
Mm-hmm. That's right.
So, passing of time means an awful lot. A lot of it's just like when Gary came in and told us about Jim Neighbors passing away. It's just like all these things are going to happen. Medicare changes, Medicaid changes, the government changes. It's just like I read something on the Elder Law and Hernia Network and said that this tax plan they're trying to push through the House of Representatives They pushed that thing through, Rob, in 2 weeks, and they never had a House hearing on it. Never had a House hearing. And this is going to be what forms our tax base over the next few years, or maybe 30 or 40 years. But something that's very important to, we try to, like I say, the purpose of the show is information. While Rob and I are talking today about assisted living care and everything, a lot of you need to really pay attention to your Medicare Part B stuff, because I found out today that the Medicare Part B premiums are jumping 23% this coming year, starting 1 January, for many retirees. What's happening is that there's something, and I need to go to our Shine people to find out about this, because they're saying that for 70% of Medicare Part B enrollees who currently pay a lower monthly premium due to what they call a hold harmless legal provision, their monthly costs will rise by as much as $25 to $134 per month from the 2017 average of $109. And for senior citizens living on a fixed income, folks, that could be significant. And I advise you to contact your Shine counselor to find out what that could mean to you as an individual. It's best now to know about these things. And that's another advantage, Rob, is about radio. It's just like, I'll go back and I'll say it again. If people call CarePatrol, they can get you to come out, and they can say to you, Rob, this is what my situation is. And Rob can go back and take a look at it and say to himself, this is not really what the situation is, it's this. And that's how, in many cases, you help so many people save wasting time, wasting money, getting people in the wrong element of care, when your whole purpose is to get them in the most efficient, effective element of care that fits their situation.
Yeah, I think that's right. I've been so surprised. The numbers are staggering. Since we've been doing this, will be 4 years in March of 2018. What has been staggering is the amount of times where we get calls from families who placed a loved one in an environment, be it assisted living, memory care, what have you, based upon either a list of facilities that was handed to them, or an advertisement that they saw, or a friend said, yeah, I have a friend whose father is here and they're happy. They'll call and they say, look, we made a mistake. Can you help us find the right environment for Dad? So we are in a situation where we have to unwind everything that's been done, more or less break down the walls of what their understanding of the situation was, and start to get a good foundation of what needs to be done for Dad and how best to go about it. So, as we said at the outset of the show, there's a lot of misinformation out there. There really is. And there are people that are not particularly scrupulous, and elder abuse can come in all shapes and sizes. Leading seniors down a wrong path vis-a-vis misinformation is a perfect example of a situation that really can be avoided if we can somehow get information out to people that desperately need the information so that they can make the most informed decision for their loved one.
If you go to a church bulletin board, I just said church bulletin board, you could go to a church bulletin board, you could go to a supermarket bulletin board where a person's got an advertisement there for in-home care services, and you might call a person, have them come out, they sound nice and everything else. You haven't done a background check on them. You don't know their references from Adam. You have them come in, and you find out weeks, months later that the wife's wedding rings are missing, jewelry's missing, things have been taken from the home, You check the person's not licensed. There's no company, as you had it earlier, agency. People have no recourse to try to reclama or get back what they lost. And those are some of the typical things that happen. I could give you a list of elder abuse that it's a day long, and it means nothing unless somebody has a way to act on it. And if you don't have licensed caregivers coming into you, you have no way to fight back, do you?
No. If something happens, for example, a piece of jewelry has gone missing from a home, there's no chance. They're never going to see that again. They're just not. And if it was taken, there's no way to prove it. And do you think that individual is going to say, "Oh, geez, my bad. I'm so sorry. Yeah, I took it, but here it is. I'll give it back to you." Come on, that just doesn't happen. So there are ways to protect yourself, and ways to protect yourself. One of the best ways is work with a reputable company that can help guide you to the best resources that are reputable and will deliver on the services that they're supposed to deliver on in the community.
Yep. And even those reputable companies make a mistake in hiring people.
It happens.
It does happen. But if it happens with a company like that, you stand a better chance to get some kind of reimbursement.
Of course.
That's the important thing, Rob.
Yeah, I mean, look, there is a significant amount of regulation as it relates to caregiving. And that is a good thing for the consumer. So if you are working with a company, and I'm putting air quotes around the word company, that uses unlicensed staff, you don't hold a candle. You don't have any chance whatsoever, because if you call the state and you verbalize a complaint, if they're not licensed, the state has no authority over them, and there isn't anything that they can do about it. So then you have to chase them through the court system.
All right. Let's say in the process of going out, and you use the number, and I've heard anywhere from 150 to 170 assisted living facilities in Brevard County. And right away you can take the ones that have anywhere from 1 to 3, the mom and pop places, and you can pretty much rest assured that they're not licensed. Or am I saying that incorrectly?
A little bit. So let's just be clear.
Okay.
When we're talking about assisted living, that is a location that is not in your home, that's licensed, and they're responsible for helping individuals with their activities of daily living. And then there are different licensures within assisted living that allow them to do incrementally more care, such as managing someone's diabetes, for example, insulin shots, sugar checks, things of that nature. In fact, there's a licensure within assisted living called extended congregate care that allows that facility to care for someone who has a feeding tube or a peg tube inserted. There's also something called adult family care homes. Now, adult family care homes are often confused with residential assisted living. You drive by them, they look exactly the same. They're both homes, but one is licensed adult family care, the other one's licensed assisted living. Adult family care homes, they're licensed adult family care, and they're there to, again, provide assistance with showering, clothing, grooming, transfers, things of that nature. But that's where their licensure stops. The other difference is that the owner typically lives on site, whereas in a residential assisted living environment, it's rare, and I mean rare, that the owner lives on site. So there are differences, and the 95% of all adult family care homes, and there's only about 15 of them in the county, they're located in Palm Bay. Palm Bay has the highest density of assisted living in the whole county. as you might imagine, it's by far and away the largest city in the county.
Right.
So there are differences between adult family care homes and assisted living. Assisted living, remember we talked earlier, you have the larger ones such as Zaun, Hibiscus Court, Riverview, and then you have the residential. The residential assisted living facilities make up about 90% of all assisted living in the county. Then you have, and those typically, by the way, the residential assisted living are licensed for 5 or 6 people. Adult family care homes are usually licensed for 4 people. Then you have homes. My home, for example. Did you know that I could have 2 people in my home living there and I can provide care for them without being licensed? And it's perfectly fine in the eyes of the state of Florida?
Do you do that?
I don't do that, but I can do that. You could do that. Anybody could do that.
Oh, okay.
So those are the places that you need to be particularly careful about, because there's no state or government oversight whatsoever.
Okay, that's what I was talking about.
Those are you never know where they are, because they're not regulated, they're not licensed. You don't know where they are, but you know they're there. I've had owners say, well, you know what? I have all my licensure paperwork into the state of Florida, hasn't been approved yet, but I want you to start giving us referrals. And we always say, no. Call me once you have been officially licensed by the state of Florida, by the Agency for Healthcare Administration. That's the regulatory body for Florida.
Well, as I remember it, when I first started out in the care business, if you refer somebody to somebody that you know is not licensed, it's a felony, it's a crime. Or it's not legal. I know you can be held to task for it.
You can be. You can do it, but God forbid if something happens to that individual.
Yeah. Then you're in trouble. If you've ever, I know what it was. If you like, running an adult day healthcare business, I could not legally advertise for somebody I knew that was not licensed.
That's right.
Okay, that's right. The way it is.
And our company's profile throughout the country, we have over 150 offices in 40 states. So our company profile is such that we will not ever refer someone to a non-licensed facility.
Okay. So you see, folks, here Rob does this stuff on a daily basis. I've been doing it for 28 years, and there's still questions I'll have about what different organizations do. Can you imagine yourself as a first-time person coming into this business, trying to figure out where to start, how to get the best care, and what we haven't even talked about, Rob, is the enormous price differences in the different types of care we're talking about. Perhaps you could talk just for a few minutes about that so people get a better understanding of what they're going to pay. Sure. $30 a day or $300 a day.
Sure. So let's see, what's the best way to break this down? If we talk about in-home care, and we're talking about non-medical in-home care, so it's not a registered nurse coming in, it's a certified nursing assistant, and they're providing assistance with some activities of daily living, very light housekeeping, and some meal preparation. That cost will typically range anywhere from $17 to $20 an hour. Usually, the vast majority of these companies, be it registry or agency, will want a 4-hour daily minimum. You don't have to have someone go out every single day, but every time that they do go out, they're going to want 4 hours minimum. So at worst, if it's $20 an hour, if it's 4 hours for that minimum, that's $80 a day. And if they go out twice a week, that's $160 a week. What is that? That's $640 for the month. If I did that fast, yeah, I think
you got it right.
$640. So that's twice a week, 4 hours a day, $20 an hour. As the care needs tend to escalate, as we said earlier, if someone has to be at that house 24/7, that is going to generally be $9,000 plus, depending upon how much care is involved. And if the individual is such that he or she, for whatever reason, needs two-person assist to get out of bed, to get out of a chair, to be safe in the shower, then the price can really go up because you're two people out there.
Right.
Now, if you look at assisted living can range for a shared room anywhere as low as, call it $2,000 or $2,200 a month. Private rooms, depending upon availability, can go for $3,000 a month and
Right.
up.
I agree.
Okay, and if you're looking at memory care, secure memory care, such as Autumn House, Zion Beachside has a secure area. Hibiscus Court,
Right.
Riverview does as well. Those can be $5,200 and up a month, depending upon if it's shared or private. It's tough to spend more than $6,500 a month, though I've seen it, and it was unnecessarily done. A competitor of ours placed someone in a residential assisted living facility 2 years ago, and for $14,500 a month. I looked at them, I said, why, for the love of God, didn't you not keep them home?
My gosh.
Yeah. So those are the range of prices in a non-institutional setting. If you look at a nursing home prices are going to be $300 plus per day.
Yeah.
So
and they're going higher.
they are.
And one of the concerns that those of us folks in the care business have with the new laws are hitting and possible changes in health care and the way Medicaid is regulated throughout the state. If we lose the ability to mix and match, is the best way I can say it. Rob right now has a latitude where he can take a look at what a person's resources are, whether they're on Medicare, whether they're on Medicaid, whether they have long-term health care planning, and you can sort of mix and match all those resources to get the people in the best element of care that they can afford.
Yeah, it's important to understand because so many people are under the impression that Medicare will at least offset the cost of in-home care or nursing home care or assisted living care. It doesn't pay 1 red cent. Medicare,
Not 1 cent. That's right.
Medicare is not designed to be part of the solution for long-term care. Medicaid, there's some confusion about Medicaid out there. Medicaid comes in a few different shapes and sizes. There's Medicaid, which acts as a supplemental insurance to one's primary insurance, be it straight Medicare or a managed Medicare program. And that Medicaid, just like any other supplemental insurance, you've probably heard of AARP or Blue Cross Blue Shield, TRICARE for Life. Those are supplemental insurance plans that are designed to pick up where Medicare leaves off in the world of short-term care.
And that's medical care.
That's medical care.
Right.
So if there are any copays related to doctor visits, to medications, that
Right.
supplemental will pick those up.
Right.
Now, there's another type of Medicaid, and that Medicaid is long-term care Medicaid, okay? And that comes in there are three different hats for that. One would be in-home services.
Okay.
2 would be to partially offset costs associated with care and assisted living.
Okay.
And the third one would be to pay for nursing home care. And in the state of Florida, it's a great state, but not when it comes to accessing Medicaid, long-term care Medicaid, that is, because let's talk.
You think 60,000 people on a waiting list is too many?
It's up to 68,000 people, and
68?
I have to tell you, if you are sitting at home and you are viewed by the state representatives as, in other words, the people who go out and visit to determine the medical need of that individual, of the applicant.
Right.
If you're sitting at home, which is a quote-unquote safe environment in the eyes of Florida, and you have some basic needs, you're going to be waiting for a few years to access that Medicaid.
And this is what people don't understand.
No,
Rob.
they don't.
They think that Medicaid is a great thing.
Sure.
It's great. But this is what we're going to have to figure out how to overcome this, and this is why we've advocated for many years that Brevard County itself needs to have an aging plan, because if we don't figure out a better way to use some of these assets or use some of our county general fund revenue to bring in Medicaid money to help people deal with some of these problems, we're not going to be able to meet all the need.
Yeah, well, Florida's in the crossroads of a bad situation. You have a state that when the implementation of Obamacare was, January of 2013, and the exchanges weren't functioning correctly. And the federal government said, look, to try to ease some of the pain associated with those exchanges, we're going to increase subsidies from a federal point of view to the state-run Medicaids. There were a number of states that said thank you, no thank you. Florida was one of them. So it is funded state only. Oh, by the way, we don't have state income tax. So we're living off of sales tax, we're living off property tax, we're living off the lottery. And by the way, we're a great weather state, so we have an abundance, a high proportion of seniors that live here. And if you look at the correlations that exist out there, there's a higher proportion of indigency, at least in Brevard County, if not in other areas of the state, that really desperately need access to this type of funding and simply can't get at it. And
this is one of the hardest things, Rob, to get legislators and commissioners to understand. They simply, I think they understand it. They just don't want to admit to it because without causing a furor among all the people that will elect them, they're not going to get them to move off the top of the center and make a change. And this is when, I just can't emphasize enough, Rob, for people to know more about companies like CarePatrol that can help them get started in the right direction. You can save a lot of. You got maybe 15 seconds.
Oh, just, you know what, folks? If you have questions about these types of things, feel free to call us at any time. Our phone number is 321-652-6851. It's 321-652-6851. And one of us will be happy to pick up the phone and answer your questions.
That's your wife, right?
No, that's me.
Just you?
My wife has a different number.
Oh, okay. All right. Okay. Well, really, folks, do think about what Rob and I have talked about. It's great information, especially now that we're thinking about 2018 coming around the corner. We'll see you next weekend. Bye-bye.